begin. So this will be a very short session where I'll orient you towards gynecology. The topics in gynecology are very simple, and there are no matter what question they ask, you can use the same points over and over again. So first, the most important thing is your anatomy of the female genital tract. This is going to be the same diagram which I drew for obstetrics. So I'll just draw a quick diagram over here. So you can keep using and reusing the same diagram to show all the various pathologies in the. Okay. Various pathologies in the female genital tract. So other than that, the physiology of the menstrual cycle, the estrogen, progesterone, your luteinizing hormone, your ovulation, all of those things are going to be repetitively. You're going to keep writing that over and over again. So there are mainly 1, 2, 3, 4, 5, 6, 7 topics per se in gynecology. The first one is menstruation and menstruation related diseases and disorders. The various questions which they can ask are going to be a precocious puberty, amenorrhea, dysmenorrhea, menopause. There's one more, PCOS. So all of these are related to the menstrual cycle. So if they ask any of this question, you write about the normal menstrual cycle, the ovulation, the follicular phase and the luteal phase, and then how menstruation takes place. All of that you can write, and then you can go into each of these conditions. Like precocious puberty is early attainment of puberty. Amenorrhea is absence of menstruation. So this is again primary and secondary. Primary is related to various syndromes and congenital non-formations. Your secondary amenorrhea is where you had menstrual cycles, but later on they don't have menstrual cycles due to some kind of pathology over there. Dysmenorrhea is painful menstrual cycle, and menopause is your stopping of menstrual cycle, and you're going to have a perimenopausal period over there. So all of these are the various questions, and everything is going to be related to two hormones only mostly. Okay, your estrogen and progesterone. So the main function of estrogen is going to be proliferation. Okay, progesterone is maintenance. Another important point is withdrawal of progesterone is going to cause your menstrual cycle or your menstruation per se. Until progesterone is there, it's maintained. Once your progesterone goes away, your layer starts to slough off. Okay, so that is regarding all the topics related to your menstruation. So how do you approach this? Is you read about the menstrual cycle, and then you read about each of these diseases in specific, their classification, and all of their management is going to be very similar based on these two hormones only, estrogen and progesterone only. The whole of the management is going to revolve around. Okay, the second most important topic is abnormal uterine bleeding. So definitely there will be one question based on this. Usually it's going to be either your adenomyosis or leiomyoma. These two are commonly asked. Others are less commonly asked. So you need to know about this Palm Cohen. So the expansion of Palm Cohen is your P for polyp, A for adenomyosis, L for leiomyoma, M for malignancy, and C for coagulopathy, and O for ovulatory dysfunction, and E is for endometrial dysfunction, I is for iatrogenic, and N is for not yet classified. Okay, all of these are going to present as bleeding per vaginum, and they're going to have similar management. That is, for pain, or if there's going to be pain associated with bleeding, you will have NSAIDs. And then if there's heavy bleeding, you're going to make the blood clot by giving mefenamic acid and tranexamic acid, all of those things. And then those are the common things. And then you can switch over to hormones to regularize the cycles, and minimize the bleeding. So you can start on progesterone only pills and OCPs. All of those are going to be same for almost all conditions in gynecology, even in abnormal uterine bleeding. And then you have some special procedures like uterine artery embolization, and then myomectomy, and then your hysterectomy. All of these are last case, like uncontrolled bleeding, and the patient is going. So you have bleeding, right? So you're going to have anemia. What type of anemia? Iron deficiency anemia. So you're going to have pallor, and then in long-standing cases, you can have choronoria. All those findings, you just keep adding on to your answer to add bulk to it. And then that is about your abnormal uterine bleeding. Then you have your infections, right? So infections is going to be presented as white discharge. Okay, the color of the discharge, the consistency of the discharge is going to vary in various conditions. So the three common uh, thing which I'm going to ask is the bacterial vaginosis. So the important bacteria there is Gardnerella uh, vaginalis, and then fungal is Candida albicans in immunocompromised patients, and then protozoal is your trichomonas. So for bacterial, you do your culture, your agar culture. Your fungal, you have your 10% alcoholic KOH and Sabraut's medium. For protozoal, uh, you will do like microscopy, special GEMSA microscopy, GEMSA stain, and you will be able to detect your trichomonas. Other diseases are like your herpes, human papilloma virus, and syphilis, chlamydia. All of these are not only exclusive to genital tract; they affect other parts of the body too. Chlamydia is genital tract related, but herpes and syphilis they'll affect other parts of the body. And there's one more, gonorrhea. So these are all the various infections. Everything is going to have white discharge. You're going to have some kind of fever, irritation, and then your investigations I told for the most important ones. And then all of these can be complicated into your pelvic inflammatory device, pelvic inflammatory disease or PID. This is a very dangerous condition, and it needs to be taken care of. And then you have, that is about your infections. Each one of these infections you can see 4 to 5 more points in detail. And then about your infertility, this can be asked as a short note. So there's male infertility and female infertility. So that is about like you need to know about spermatogenesis, oogenesis, the genital tract pathway for you to understand that. There will be infertility. Then contraceptives is going to be inevitably there. So you have hormonal, mechanical, and practices and emergency contraceptives. All these are very important. Just give me 1 second or something, some problem with the light. All right, so let's continue the contraceptives. You have your hormonal contraceptives, your OCPs, your progestin only pills, and you have other various injectable and implantable hormones. So that is about your hormonal thing. Each of these has its own side effects and benefits. So everything is going to be based on the functions of estrogen and progesterone only. So that's the most important thing which you need to know. And then your mechanical, you have your condoms, cervical caps, diaphragms. All of these are your mechanical methods. And then practices, you have abstinence and calendar method, and then lactational amenorrhea. All of these are not very effective, but you can just mention them. Then emergency, you have four methods. One is your levonorgestrel, second is your copper T, your third is high dose OCPs, not generally used, and your last one is ulipristal or mifepristone. So these are all your emergency contraceptives which you can give. Everything is based on the same estrogen or thing only. So last two topics are going to be your malignancy. The most commonly asked one is your CA cervix. So mostly that human papilloma virus 16, 18 strains are going to be most common. Then you have various stages like carcinoma in situ where you have coilocytes, and then you have invasion of the basement membrane and then spread to various others. You have to do a laparoscopic staging procedure for you to take care of it properly. So all of these are the important things when it comes to CA cervix. CA ovary, you need to know the histology of the CA ovary. So all the various cells, your sex cord cells, and then your epithelial cells, and then your Leydig cells, your Sertoli cells, all of those. So basically, it's going to either secrete a lot of estrogen and cause problems, or it's going to be become big and they cover a big part of the abdomen and cause a problem. So in this, there will be variations in spinal umbilical line length on abdominal examination. So those are the specific points for that. And then CA endometrium. It again you need to know the uh, structure of the uterus, and then laparoscopic staging, and then your examination is going to be like you'll see some kind of mass in the lower abdominal segment. So that will be all about your malignancy, and your TNM staging for all of these are very important. Here you do something known as laparoscopic staging, and that's how you detect which stage it is. And you're going to use all three methods like surgery, radiation, and chemotherapy. So all three are used for all three of these malignancies. Last one is prolapse. So prolapse in the sense, the most common one is your uterine prolapse. You have rectal prolapse that is asked in your surgery paper. So you need to know the anatomy of the uh, perineum and pelvic region. So based on that, when the fascia are weakened, the supports of the uterus are weakened, or there's some kind of trauma, or there's some kind of weakening of the urogenital diaphragm, or uh, your posterior fascia, that's going to be your uterine prolapse. This is again a short note which can be asked. So those are all the various questions which you need to go through. So I hope this gives you like a quick run through of whatever you need to focus. A quick recapping would be like focus on anatomy, physiology, and functions of estrogen and progesterone. You're going to be using this for most of the thing. Second, your OCPs, your progesterone only pills, will come in your contraceptives and management of almost all conditions in gynecology. Lastly, your malignancies and infections you need to give special priority to. So that would be all. I would like to end this session over here. Thank you.